fracture, a break in the continuity of the bone. Break in the continuity of the bone. On a classification on the basis of the etiology, traumatic, pathological stress. Pathological due to a considerable force is there, like road traffic accident, fall or fight. Pathological due to some diseases, metastasis due to that, it will cause non-union. When a very less force is needed for causing that fracture. Next is stress fracture due to chronic repetitive injury. It causes a break in the bony trabeculae. The patient have symptom pain, but in X-ray it is not visible. This is on the basis of etiology. On the basis of the displacement, undisplaced and displaced. Displaced, it will need some force is near. There will be a fracturing force will be there, and a muscle pull on the fragment would be there, and a gravity also affected. It can cause shift fracture, angulation fracture, rotational fracture. Next is on the basis of the relationship with the external environment. Open fracture, closed fracture. Closed matlab kya hai? Skin and soft tissue will be intact. It will be intact. Open matlab it will be open. A break in the overlaying skin and soft tissue, it's open. The open fracture can be again divided into internally open and externally open. Internally open matlab a fracture endpoint break the skin and subcutaneous tissue internally. Externally open matlab an open the skin, laceration wound will be there by an open injury to the laceration of the skin and soft tissue will be there. It causes open, that is externally. This is internally by the fracture point part of this sharp weapon causes internal open fracture. Okay, on the basis of relation to external environment. Next is on the basis of the complexity of treatment. Simple fracture, complex fracture. Simple fracture matlab into two pieces, easy to treat. Comminuted matlab multiple fragment will be there. Okay, on the basis of the quantum of force causing fracture, high velocity injury and low velocity. High velocity injury matlab road traffic accident. There will be periosteal injury, soft tissue injury, muscle injury will be there. Devascularization of the fracturant. Devascularization of the fracturant. Unstable, very slow in healing. Low velocity injury like fall. Next is about the transverse fracture. This is the fracture line. It is a long axis of that is perpendicular to the long axis of the fracture line will be perpendicular to the long axis. So bending force causes oblique fracture. Spiral shaped, that is spiral fracture. There will be two fracture in one bone, that is segmental fracture. Thank you.